Friends, good afternoon. Welcome to one more session of our YouTube Live. We are live both on Instagram and YouTube both. So let us start the session again. Welcome Dr. Nathima, Dr. Kokala. I hope I've spelled it right. Just to give you one example of one a very interesting case, just an acute case, I would like to share that. A patient came with lot of problem of cough. He had a problem of cough. I hope everybody joins in early so that we can start, and I will just share one case. So there was a lot of uh, medicines given to the patient, and he was not getting total complete relief, though he was better with some symptoms of cough. And then when we basically tried to analyze that case, we found that the patient told that whenever he's angry for anything, maybe for emotional cause or some financial cause or related to career, whenever there's anger, the cough starts more. And of course, we asked those other symptoms, and very much surprising, very much surprising, we gave the patient a single dose of Sina. Sina, yes, my friend, Sina, and with Sina, the cough was completely resolved. So this was a very interesting experience in my case, because if you ask me for Sina for cough, I had used it very sparingly in my practice. Not many cases which I can have, but this was a very interesting symptom of that patient, that anger from cough. Okay, and then Sina worked very well, and the patient was cured. So let's welcome Dr. Renu, Dr. Sadhna, Dr. Meera. Good afternoon, Dr. Masarra, Dr. Shala, Anja. So this was Sina cough, and Sina, when I read Sina cough, I was very much happy to know that there are so many symptoms of Sina which we basically get from the patient, but owing to our knowledge of the polychrist remedy or the so-called acute remedy for cough, we never think about Sina. One of the very important symptoms when I found about Sina cough is that in Hindi patient हमको आके क्या बोलते हैं, डॉक्टर साहब खांसी आती है बट मैं थूक निकल लेता हूँ, खांसी आती है मैं थूक निकल लेता हूँ. And then we have reasons that the child is small, he does not know how to cough, and other symptoms. But this is a very, very important symptom of Sina. When I read Sina after I cured that case, Sina has a very important symptom: swallows after coughing. Swallows after coughing, and this is a very, very important symptom of Sina. One more symptom is that cough ends in spasm. Cough ends in spasm. Apart from that, cough because of anger. And of course, there are other symptoms of Sina cough which I basically read. That is, after coughing, there is a lot of moaning. And the patient gasps for air, and the patient turns pale. So close to, Sambucus nigra. In majority of the cases, we give Sambucus nigra, and basically we get a lot of relief with that remedy. But if you start studying Sina cough, you'll be very much surprised, and we got a good relief. Although I entered the case from anger, cough because of anger. So this is in short, I just wanted to share that experience. Welcome Dr. Mithali, Dr. Babal, Dr. Vishaka. Dr. Ra has a question. I have a really interesting case. Young boy, 15 years old, has becomes psychotic with OCD. He had fear of contamination. He keeps washing himself and forget that he has wash to repeat. He keeps repeating the washing and does not want anything to touch him. And yeah, so this is see, basically in OCD, these basically symptoms are taken as common symptoms, and so if you just prescribe on these symptoms, you'll hardly get relief. And in my initial practice, I have had a lot of cases of good cases, but I could not get results because I was prescribing on those symptoms like washing hands, keep checking whether the door is locked or not, or does not go to the bathroom outside because he feels that he'll get infection, does not come to a person near who is coughing, otherwise he feels he'll get infection. And most of the time we thought about calcareca, tarantula, sulfur, moscus, which did not get relief. In OCD, it is obsessive compulsive disorder. The main symptom that you have to get in OCD, which I have been able to cure lots of cases, In OCD, one thing is very important. Ask what is in Sora. Now, please understand this, what to ask in Sora. Ask what is there in Sora, and that part which is in Sora becomes more intense in psychosis, and that part in psychosis becomes more intense in syphilis. So as I think one of my seminars in the London group, Dr. Raha, I told you the chain of disease is never broken. The psoric symptoms become so intensified in syphilis that if the patient is having a habit of cleaning, that habit increases, and becomes an obsession, like panic disorder. Started from anxiety, then maybe the patient is anguish, and then a lot of panic disorders. So it is very, very important that you find out what was there in Sora, and then keep on gradually asking which has become syphilis in that syphilitic stage. Okay, and he's fine if he plays his computer game and when he goes to school, but he has missed a lot of school due to being late from washing. Yeah, in guinea pig died. Is guinea pig died? He spent too long in the bathroom, and by the time he came out, he pest had died. Yeah. So I'll just take your question, Dr. Kamalav, after that. So in this case, it is important to get Sora symptom. In your case, there are 2 or 3 remedies that immediately come to my mind, and that would be: first is arsenic album, second is tuberculinum, and third is very important remedy again, cuprum metallicum. Now, one remedy that you should all remember that works very well in case of OCD with this type of symptom is Pinus. Pinus sylvestris is a very, very interesting remedy. Please do go home and read that remedy. Out of these 3 symptoms remedies, you should have that case. But again, I would tell you what was Sora is very important. Sora, psoric symptoms which get intensified too much goes to psychosis and then goes to syphilis. So make sure that you understand what is in Sora, and then you can basically what you call. Take some remedies which I have told you. But basically, what I can get in your case basically is this: one of the 3 remedies. You study Pinus. Pinus is a very, very interesting remedy that you should look about. Okay, but if I'll be more happy that if you give me what was there in Sora and now it has been intensified in syphilis, that leads to OCD. So one question I have on Insta, I'll do that first. Sir, stress induces acne. Which medicine to prescribe? Now, simple. No, see, whenever there is stress, means there is basically an emotional trauma or an emotional baggage which the patient is trying to, or the body is trying to take out through skin or through face symptoms, like simple as acne. Now, if it is simple acne, and it is not disturbing the patient, just put the patient on phytum, because it is a psoric expression and the body is trying to clean up the toxins because of this acne. So for me, if I get this case, I'll tell the patient to drink a lot of water, do hygiene and all, and that's all, because the body is trying to throw away that emotional baggage. But still, if you feel that the patient goes out of control, the acne have been increased, they are indurated, radiation color, do think about 3 remedies, very, very important because of emotional trauma. First is a Kali, that is most important, is Kali Ars. Second is phosphorus, and third, think about CP and zincum metallicum. These 4 or 5 remedies are very important if the acne are because of some emotional cause. I have given him arsenic, but that helped a little, but he would get into frozen mood, standing still for hours, till too tired, and then which fall lie down in fetal position. Okay, so you may add one thing, the obsessive part, that is, you can think about Kali Ars. If arsenic has helped a bit, think about Kali Ars. But I would still tell you to give me some psoric symptom which has an intensified effect in syphilis. One more question, Dr. Arun. Male, 57 years, 2 years ago, pneumonia, HRCT 2, 23, now pain in lungs. Okay. Now see, if you have pneumonia, HRCT and pain in lungs, simple as that. If the patient is suffering from, the patient has suffered from COVID and he has pneumonia and now pain in lungs, there are a few remedies which are very, very important, Dr. Arora. You must start thinking first of Bryonia alba, second is arsenic album, third is Kali Carb. These are the most commonly indicated. You must also think about some rare remedies, that is eucalyptus, yerba senta, And one more remedy that you should not forget, it's again a very, very rare remedy again that you must think about. Anybody have some guesses? One rare remedy that you should think about when there's pain in lungs, that is strychnine phos. So these basically are the remedies, four common and four uncommon remedies. Welcome, Dr. Isha. Arsenic album would get him out of that. Yeah, yeah. Just add one more, because arsenic album has not helped you totally. So you have to add some of the salt of arsenic, that is a kali or natrum or ferrum. But whatever I can get from sora, that should be kali ars. Eucalyptus in potency, don't give mother tincture, because I have seen mother tincture would suppress the cough and later on the patient normally would suffer from asthma. So eucalyptus 30 in repetition twice a day for 3-4 days should be a good repetition. Sir, your press of arsenal 300 dose helped me with weakness, harshness in throat, right nostril blocked totally. Yeah, Shamil George. So wait for some time. I think I prescribed you today morning. So wait for some time, Dr. George, and wait till the evening, and then we'll see what to do. Don't hurry up the case. It'll improve. Just take a steam. That's all, and you should get out of it. Medicines for melasma. Yes, it's such a melasma. So many in so many YouTubes. It was asked to me, and I would tell eucalyptus. I told you yerba senta, Iridiction. Those are very, very important remedies and important remedy that you should know. So melasma. Good afternoon, Dr. Vaishnav. Melasma, see, if I am very frank, I'll tell you also that for me also treating melasma, very, very difficult and very, very irritation, because the patient keeps telling us, give some local applications, when will it get cured and all. So melasma, I just take throughout 2 or 3 symptoms. I have seen melasma, I have differentiated melasma, where one melasma is black in color, which comes to me for basic melasma that comes to in our OPD. Second melasma, then the discoloration is about a radiation color. And the third, which I have seen melasma, which is very, very what you call rare, but then you can have these double discoloration, that is bluish in color, which I have not seen so much in life. Blackish in color melasma, I have told you before also, normally I start with China, and one remedy which I have told you before also, which I can recollect, is Onintho crocata. You must have heard this in other previous YouTube. Radiation color, normally I think about Veratrum viridi first, then Carbo Wedge, and third Belladonna. And if it is very dusky, neither red and neither dusky red, I normally think about sulfur first. For umbilical hernia, what should I give? Mira, for umbilical hernia, I don't know whether the age of the patient, but if it is age of the patient is 50 plus, the patient is very obese, that is already causing pressure in the in the umbilical area. I think the most important thing would be to just tie that crepe bandage around the umbilicus and then give some remedy. Basically, I prescribe lycopodium. More importantly, in one case, I just at random, I told the patient to apply lycopodium mother tincture, and the patient reacted wonderfully. So lycopodium is a very interesting remedy. Calcarea floor again is a very interesting remedy. Second, and third, you should think about abrotenum. Uric, did you speak of? Yeah, strychnine phos, Dr. Babel. Eucalyptus, welcome Dr. Amit, Dr. Vaishnav. Uric acid 7, give lycopodium in constitution and article, no relief. Uric acid 7, if you see the books of medicine, 7 is not so high. There is no need for medicine as such in 7. But if you feel and if you give lycopodium as a constitutional medicine, Artica urensque does not work. If you want relief in what you call uric acid high, and if you feel that your case taking is not good, you want to just give relief to the patient, 2 remedies everybody have to think about. Think about benzoic acid and think about colchicum. Very, very important remedies, and you will definitely get relief. Just see the symptom differentiation and you will get the relief. Don't give articulins. A lot of people ask me, but articulins has never helped me in my practice. So colchicum and benzoic acid. Sir, you said to give trillium pen has relief from my patient. Thank you. Wonderful, Dr. Meenal, and thank you for sharing the case. If you could share some symptoms more about that case, so that we can all know in which symptom did you prescribe, and then we'll be able to learn from that case, Dr. Meenal. Okay. Patient has to lean forward to urine in BHP. What to give? See, leaning forward and leaning backwards in BHP, I remember, when people used to ask me that the patient can pass urine better by bending backwards, and you always said that zincum metallicum should work, but it did not work in every case. But see, if you still feel that, see, it is basically in BHP because it is causing a pressure, and the patient basically has to pass urine with pressure. So it's not always that with that remedy, the patient would be able to, what you call, pass urine. Symptomatically, you can think about three remedies, very, very important. Uh, one is Thuja, second is Sarsaparilla, and third would basically I have used very rarely, that is Belladonna. Sorry, the connection got cut. I missed the question you asked me. Yeah, I was just telling you, Dr. Raha, ask what was there in Sora, which has been intensified in the stage of syphilis. Because that which I told you in our, I think in our webinar which we take for foreign students, I tell you the chain of disease is never broken. So what was there in Sora has gradually, which has not cured, is not cured with the medicine. That's why it keeps changing the form from Sora to psychosis, now to syphilis. So ask what was there in Sora which the patient wanted to change, could not change, which was very prominent in that case, and that has gone to syphilitic stage. So that's very important. So please put a light on how to approach ACL surgery knee pain. I have started with Ruta LM3. I think Ruta LM3 would be fine. Just if you feel that the case is not working, you must think about Calcarea floor and Bellispur also. These three remedies will do wonders in case of ACL. No surgery required. No surgery required. In fact, if you want, you can give a dose of Calcarea floor, 30 or 200 depending on the susceptibility of the patient, and you can continue that Ruta LM3. No need for surgery. Don't go for surgery. Homeopathy medicines with physiotherapy would cure that case. Yeah, Dr. Pal, good afternoon. Dr. Raha, I hope you were I know you were there in that case where we did a webinar every alternate Sunday we used to do, and I had told you on case taking that the chain of disease. So if you have, you can go home and study that. That's a very important point. Unless you get the simillimum, the symptoms never go. So ask what was Sora. Sora is very important. Pterygium, what medicine we should think no other eye symptom? This, I think, pterygium is such a question where so many, it was asked so many times in my YouTube, and I'll just again tell you some symptoms of pterygium. And if you see my YouTube live videos before also, I have answered this question, but I had a very interesting case of pterygium where the pterygium was exactly pink in color. Argentum nitricum cured that case. Argentum nitricum first. So remedies which you must remember for pterygium is Argentum nitricum. Second remedy, again very, very important in pterygium, is pulsatilla. Third remedy is lachesis, and the fourth remedy that you should remember is Calcarea carb. There are other remedies, but these four remedies have given me fair good results. And to be frank, I don't have so many cases of pterygium where I can tell by authority that these remedies work. But whatever cases I've got in my practice, these four remedies have given me good relief, and with that, Argentum nitricum has helped me very well. Samir, welcome. Dr. Kailash Chaudhary, welcome. Sir, what is next webinar? I need to start. No, Dr. Sarma, that was an international webinar we used to take. I used to take for international students, and one of the member was Dr. Raha. So I was just talking about that. I will start in near future. Cystodyma of the pancreas. Okay, that's a fantastic case. If you see, I always tell just a minute. What is, yeah, I'll just first answer that question. As I always say, if you are a good practitioner, you must have basically good cases also. You have to be lucky to get good cases also. Now cystodyma, basically, if it is basically a benign tumor that arises, it's a benign tumor, and I have seen that cystodyma basically, basically on the surface of the over. So in this case, in homeopathy, it is very, very easy. If it's a psychotic condition and go with the case taking of antipsychotic medicines. Basically, what happens in this case, I don't have any specific medicines. I've never seen. Some doctors used to say when I used to join center that calcarea floor works very well, and one doctor also told me that you can try belladonna also, but I have not got good results with the specific. You have to go for with case taking. Next webinar. Yeah, Dr. Sangma, I used to take Google Meet, but I was planning because there are a lot of seminars, that's why I don't get time. With Hahnemann Jayanti, I have a seminar in Bombay, so that's a big one coming. So maybe after that we'll try. So please share some mother tincture for content person having delusion, wealth, having copious urination. What is sensation method that you have to ask? Who is practicing? I am not practicing that method. Sir, please share some mother tincture for content person and having delusion, wealth, have copious urine, have copious. I did not get the question, Dr. Amit. You could explain it better. Thank you, Dr. Vaishnav. What is sensation? Patient of varicocele and celiac allergic to gluten, having blood in urine, 1 to 2 drops. Yeah, varicocele, basically, I would like to tell you, good. We have very good results in case of varicocele, and I have many of cases which I have treated and cured. So in varicocele, in varicocele, 2-3 things are very, very important to understand. First of all, if you get that symptom of varicocele, the local symptom, if you get that local symptom very right, then your half the task is over. For example, in case of varicocele, there are few remedies which are very, very important. First, I would basically write, you'll be surprised, but I have got fantastic results with collinsonia. Collinsonia, write that. Second remedy that you all know is hemimaliz. Third remedy which I have got a very, very good result is podophyllum. I think I must have told you before also in podophyllum. And fourth remedy, of course, Naxomica. These 4 remedies have given me good results. Of course, there are so other remedies for varicocele, but these 4 remedies have given me good results. Try to differentiate symptomatically on the varicocele, and you will get relief. And I have lots and lots of cases, so absolutely it is curable. No need for operation. Welcome, Dr. Vinod. 7-year-old girl having cracked palms once in year before cracking some eruptions on. Yeah, if you, Dr. Sultana, if you have seen my videos of skin, I have narrated those skin about 10-15 videos. Please go and see the Mathematics on YouTube videos. You'll get the answer on that. Okay. Good afternoon, Doctor. Yeah, welcome, Dr. Tony. How are you? 80-year-old woman with breathlessness, talking dizzy, falls to left. Recently diagnosed with quite extensive pulmonary embolism. How do you focus on blood clots? I think we had I had discussed a case, I don't know, with your group or some other group. If these type of cases of pulmonary embolism come, and we basically have to manage the case, manage the case with homeopathy medicine. There are 3-4 remedies which has given me good result. The first remedy which I would like to share is Crotalus horridus. Second, it's not always that the snake remedy works, but of course in blood clots. Second remedy that is a very, very important, that is Crotalus cascavel, also very, very important. Third remedy that I have seen in my practice which can give you good results is phosphorus. These 3-4 remedies have seen good results in these type of cases. Profuse urination, mother tincture for profuse urination. I don't know, Dr. Amit, I would not be able to share some mother tincture because I have not used mother. I know only 3-4 remedies for mother tincture in relation to urine. First, I think Berberis vulgaris, I know. Second remedy is Prunus spinosa. And third remedy, which basically you might think in case of urine complaint should be hydrangea. Okay. And sarsaparilla 4. I would not be able to comment on mother tinctures. And just ask why the profuse urination is there. How is the urine? It is clear, it is watery, more in the morning, more in the night, more in the evening, and you'll be able to at 100% will get some symptom which will drive you to a remedy. Just that remedy, 30 potency single dose, should cure that case. Mother tincture, I will not be able to share so much, Yeah, sir, medicines for proteinuria. Now see, if the kidney is leaking protein, don't get that specific medicine for proteinuria. because it's a condition where the patient is might go to psychosyphilitic. In this case, case taking is very important. But still, if you want some specific remedies, you might think I have a remedy. I've given a lot of cases, that is TNT works well, picric acid works well. Second, and third, you can think about remedies. L serum is there, and one remedy is very common, which is not coming. Yeah, you can think about simple Maxwell also. Dr. Jadhav, welcome. Uh, Sir, do share some light on endometriosis. Yeah, endometriosis, maybe about, yeah, few years back, if you ask me, I had sporadic results on endometriosis, but of late, very good results in case of endometriosis. Now, whenever I remember one thing, Dr. Sangma, yeah, I'll just share one secret. If you have with you Allen's keynote now, open Medorinum. If anybody has Allen's keynote, please open Medorinum. And if you have Medorinum, in Medorinum it is about 3-4 lines. It is 3-4 lines. If you have opened Allen's keynote, it covers majority of condition in relation to uterus complete. It is written that it is a remedy for, if you have Allen's keynote, for ovaritis, salpingitis, fibroids, cyst, malignancy, with or without psychotic origin. It has got carcinoma, it has got cancer. You can trace to that psychotic history. So I have seen most of the cases where a polycrest remedy has been given after casting. If the case is stuck, Medorinum has been required in major cases in case of endometriosis in my practice. So if you feel that you are stuck, if you feel that the remedy is not working, think about Medorinum. Of course, case taking is very, very important. But in my practice, if you ask me clinically, I'm not giving a theoretical answer. Medorinum is a very, very important remedy in case of endometriosis, or for that matter, in case of any PID. If you're not getting results, think about Medorinum. Medorinum will never fail. It has never failed with me. So just go home, read Allen's keynote, and it has it at third or fourth line, it is third or fourth para Allen's keynote, and it has got everything in relation to that PID. Okay. Few questions in Instagram have scrolled up. Dr. Sandeep, welcome. Dr. Amit, I hope you got some answers. Don't ask me about the mother teachers. I'll not be able to answer it very frankly. Dr. Sangma, I hope you got the answer. Varicocele patient having blood 1 to 2 drops with medicine would help. He is allergic to gluten. Oh, there are a lot of cases, where gluten allergies are there, because you can cure that gluten allergy also. Gluten allergy can be cured, and you can ask the patient after treatment to take gluten, and he'll have no problem. I have a lot of cases. Now, if you get that because of varicocele, because of that, the patient is having 1 or 2 drops of blood in urine. 3 remedies very, very important, Dr. Sachdeva. First is arnica. Arnica, wonderful, wonderful remedy. Second, do think about phosphorus. Again, phosphorus is there if there is 1 or 2 drops of blood. And again, third remedy that you should think about is sulfur. Of course, there are a wide variety of remedies. We are not going into theoretical part of homeopathy, but otherwise I'll continue telling you remedies. But these 3 remedies which have been very useful in my practice. And fourth remedy, in case the patient has to strain too much in for urination, too much for urination, in case of varicocele, then you must think about Ruta. Ruta also works wonderfully, Medorinum prescribe in 1 potency. I normally prescribe in 1 potency Medorinum. And if you feel that your case is stuck, if you have given the remedy is working, but it is stuck, in that case, Medorinum works very well. Or I would go one step further, Dr. Sarma, if you don't understand some case and you feel what to give, start with Medorinum and see the difference in your practice. See the difference in your results. Like one of the doctors shared a case of Trillium pendulum and she got results. Next time, I'm sure if you start with Medorinum also, you will get some result and you will be able to share that case with us. It is such a fantastic remedy, All clinical tips I'm giving, all secrets of practice they are, which I have understood in my practice, that has given me good results. So either an intercurrent or you can start with Medorinum. You first go and read Allen's keynote. It has got everything in that. Okay. So Dr. Sachdeva, your question is through. No, don't repeat. Don't repeat. Just wait. Single dose, 4 tablets, 1 drop. That's all. Don't repeat. I hope we can restart a group session with more new people. Yeah, no, Dr. Tony, what happens that there's a problem of language, sometimes I took that migraine lecture, no, and there was a lot of problem with that language, English and Hindi. So basically, that's why basically we can't add those crowds. Otherwise, there's a problem. Migraine, there were a lot of questions, lot of international students had joined and they had a problem in understanding, that's why. But we'll start, don't worry about that. Good afternoon, Dr. Gaikwad, Manisha Gaikwad, yeah. Thank you. So, any other questions? It's already half an hour up. Okay. So, I think half an hour passes very, very fast. By the time I start, I feel that we basically, the half an hour is over. Any other questions? Sorry, on Instagram, there were few questions which I could not answer because I was just taking the case on YouTube. So, if you have, yeah. So, if you have some questions, you can write down in your diary. Next YouTube, I'll definitely answer those questions. So everyone, thank you for joining. Until we meet next time, thank you so much.